I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about California's efforts to implement the Affordable Care Act. And my guest this segment is Dr. Richard Pan, member of the State Assembly from Sacramento, also the chair of the Assembly Health Committee. Thanks for being with us.
Well, thank you, Steve.
So California is going through, the legislature's already started
Yes.
to try to implement the major provisions, the exchange and things like that in the ACA. That's a daunting task, isn't it?
Well, it is a daunting task, but it's also a huge opportunity to expand coverage to millions of Californians who currently are uninsured, as well as actually bringing in the funds that are needed to take care of them, and also that will help the economy as well and create jobs.
So the goal is to perhaps have up to 4 million more Californians insured?
We believe so. We would definitely want to try to get as many people insured as possible. That's going to be done through two mechanisms. One is expansion of our Medi-Cal program for people who are poor. So basically we're going to be including adults who previously would not have qualified for a Medi-Cal, and that's being fully funded by the federal government, as well as expanding and doing outreach efforts to get other people into the Medi-Cal program. But also, equally importantly, even more importantly, is that we're going to try to give the opportunity for people who are individuals and small businesses to get private health insurance through the exchange, Covered California. And so they're going to have opportunity to get affordable health care coverage through the exchange, where basically they're going to be given more leverage through this marketplace that we're going to create in the state.
I was going to ask you if you could explain how this marketplace, how the exchange would work.
So how the exchange would work is that we're going to have private health insurance plans basically compete with each other in this exchange. They have to provide a standard package so you can compare apples to apples when you're trying to choose a plan, so that and basically you can see how much is your share of cost and how much the insurance company would have to put up. And so you can choose the kind of plan that's going to make sense for you or your small business. Now, in the past, if you're an individual who has a chronic condition or you're a small business owner, you don't have much leverage over this. This is an opportunity to do that. And plus, we're going to have rules in place to be sure that you cannot be turned away for health insurance coverage if you have a pre-existing condition. That the rates that you're going to be able to get as an individual small business basically are community rates. So in other words, you won't get hit just because you had someone sick working for you or you yourself have an illness.
How are you going to conduct your outreach? How are you going to find all these millions and millions of Californians who have not been insured before to try to bring them into the fold?
Well, we need to have people work together on that. Certainly, there's going to be tremendous efforts by the state government and the federal government and Covered California, but we really need people to help partner with us to get the word out, because people who haven't had insurance for a long time, they're not just going to suddenly realize they have insurance. I mean, they've been living without insurance for such a long time. And so we need to really vigorously get the word out, programs like this with the media, also working with nonprofits, community groups, to get the word out for people to realize that they have an opportunity to get health care coverage so they can get access to affordable quality health care. That's what this is about. We're going to make California a healthier place by doing this, and certainly over the next year and beyond, the legislature is going to work hard with the administration to try to be sure we put in the healthcare system reforms in place that's going to make healthcare more affordable and accessible to as many Californians as possible.
We only have a few seconds left, but are you at all concerned that there may not be enough healthcare providers, doctors, to take care of the new caseload?
Well, that is a concern, but I believe that we can do smart policies to increase the capacity of our healthcare providers to be able to take care of all the Californians who need the care.
All right. Dr. Richard Pan, thank you very much for coming by talking about this very critical issue. Obviously, we're going to follow the progress throughout the year before January 1, 2014. Thanks again for being here.
Thank you.
And thanks to our viewers, of course, for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on My Government On Demand, also on YouTube. I'm Steve Swatt. Have a great day.